As many smaller communities in this province already know all too well, Ontario is facing an opioid crisis. Public health officials and elected leaders are scrambling to deal with it, and this week that helped Toronto and Ottawa secure backing from the province for something that so far only Vancouver has deployed in Canada, so-called safe injection sites. What are they? How will they work? Where will they go? Let's ask two proponents. Joe Cressy, he's the Toronto City Councillor for Ward 20, Trinity Spadina, and Ahmed Bayoumi. He's a professor in the Department of Medicine at the University of Toronto and one of the authors of a study that recommended safe injection sites for Toronto and Ottawa. Gentlemen, we welcome you to TVO. It's nice to see you both. Let's set up our discussion with this, which Canadian Press reported on a few days ago. 1 in 8 deaths of Ontarians between the ages of 25 and 34 is related to opioid use. And Toronto has seen a 77% increase in overdose deaths in the past decade, rising to 258 in the year 2014. These numbers show the need for urgent action and commitment. Health Minister Eric Hoskins wrote to his federal counterpart Jane Philpott. As minister and as a physician, I support evidence-based policy making and any initiative around making our communities safer. Joe Cressy, let's get started on this. How significant a change do you believe this is on the part of the provincial government to wade into this?
Well, it's a sea change, and it's a sea change at the provincial level, certainly in Toronto where we're bringing them forward, and in the country of Canada, where the Minister of Health has also said we need safe injection sites. And it's a sea change because for years we talked about drug use as something that you could hide, as something you could arrest your way to a solution, but it's a public health issue. People are dying. They're dying in increasing numbers. And unless we start to treat drug use from a public health approach, which is to say you look at harm reduction, you look at treatment, you look at prevention, unless we shift our focus, we're going to continue to lose lives. So it's a sea change because it's changed in this province.
When did your council vote on agreeing to create these sites?
6 months ago.
And why did it take the province 6 months to finally give you the green light to go ahead?
Well, I think often when it comes to supervised injection services, it's tough politics, but it's good policy. Now, what's changed is we had in Toronto 146 people die due to overdose in 2004. It was 258 people. 258 people died due to overdose in 2015. So what's changed is that the landscape in Toronto, the public knows there's a problem. And so when you see the problem, you're asking what the solution is. Supervised injection services is part of the solution. And in the province of Ontario, that's why I think this has taken 6 months, is in the past it was tough politics to talk about harm reduction like safe injection. But the problem is so visible. The overdose crisis is becoming so prevalent in communities that people are saying, what's the solution? And the province responded.
In some respects, it's taken longer than 6 months because I know, Professor, it was 14 years ago that Vancouver got its first site, and it's 4 years ago that you wrote your report recommending Toronto and Ottawa get safe injection sites. So let me get your view on that. Why does it take so long for Ontario to follow suit?
Well, there is a new narrative, and that's the narrative of overdose. And there are new drugs with the appearance of fentanyl and carfentanil, which are, when people do overdose on those drugs, they can be much more lethal than the previous drugs that people were using generally. But also, you know, as Joe was saying, there's been a change at the political level. We have new leadership. We have both public health leadership. The former medical officer of health for Toronto, Dr. McEwen, came out as a very strong proponent, and we needed that leadership at that level. But we also now have leaders at the federal, provincial, and municipal level who are all supportive of supervised injection, which is also a change.
I wonder if these sites will disappear if, and I mean, for example, Kelly Leitch is running for the Conservative Party leadership. She's come out very forcefully saying she's against it. Tony Clement, who was a leadership candidate, since dropped out, also said he was against it. If there's a change, if it took a change politically for this to happen, is it just as likely that a change politically in the future could make these things disappear?
Well, so I think one of the other things that we've seen is that this is not really a partisan issue, at least in Toronto. We have people from across the political spectrum who are supportive of supervised injection, people on the right and people on the left. That's incredibly important at the local level. And we also know that once we actually have public opinion polling data that suggests that most people are supportive of supervised injection if it can be shown that it works. And
can I get you on that, on the political? I mean, the politics change to enable it to happen. What if the politics change again against it?
Well, I would say that politicians were following public opinion as opposed to politicians leading public opinion. And that's why the future is safe for harm reduction and safe injection. So listen, in the 1970s, we started handing out condoms in schools. At the time, there were people who said, terrible idea, you're going to condone people having sex. Guess what? We reduced the transmission of some diseases. In the 1980s and 90s, we started handing out needles. At the time, there was a huge opposition. This is going to encourage lots of people to use needles for intravenous drug use. Guess what? It reduced the transmission of HIV and hepatitis C. And in the 2000s, we've said supervised injection services, safe injection sites, will reduce the harms of drug use. And they will. It just takes a tipping point. But in this case, politicians were following the public, not the other way around.
Professor Bayoumi, having said that, there is this Insight safe injection site in Vancouver. It's called Insight, I-N-S-I-T-E. There were, according to the count I've got here, 374 illicit drug overdose deaths linked to fentanyl in Vancouver between January and the end of October 2016. Does this really work?
Well, the important point, though, is that there were no deaths within Insight itself. So when people use drugs within a supervised injection facility, there are people there that can immediately attend to those people if they have a medical issue, including overdose. Does it work? Yes, there is good scientific evidence for a whole lot of health benefits, including reduction in overdose in people who are able to access supervised injection services. There has been a change. The change is the appearance of new drugs that are more potent, more toxic, like fentanyl and carfentanil, but that actually argues for the need for more harm reduction. It doesn't indicate that these facilities aren't having an effect.
So the key then is to get them to the site. It's not going to stop it in the city total, but get them to the site and you think you can reduce the harm significantly.
That's right. It's one of the reasons why we proposed a different model for Toronto and Ottawa than a single central site like they had in Vancouver, but rather sites that are throughout the cities so that people can actually get to them.
Now that does raise the issue of whether Toronto is setting itself up for a bigger political problem than Vancouver. Because there is not one site, you've got 3 proposed for Toronto, right?
That's right.
That's 3 neighborhoods potentially that are going to be up in arms about this. What do you do about that?
Well, one of the neighborhoods is in my community, in downtown Toronto and Trinity Spadina. And I have to tell you, we spent a year and a half consulting with not just the local residents, but also the local businesses leading up to our approval for these 3 sites.
Just to interrupt for a second, Joe. There's the map. There's the map of the city indicating where the 3 sites are. Which one's you're riding? The one on the west?
The one in the west, the Queen West Central Toronto Community Health Centre. And what's interesting is that in the cases of these 3 neighborhoods, it was actually the local communities who said, yes, in my backyard. And they said yes because drug use is already taking place in these communities. We're finding needles in the local playground, in the local Tim Hortons washroom, in alleyways. And so what supervised injection services do is not only do they improve the public health of people who use drugs by bringing the drug use into a safe and supportive environment, but they also improve public safety by ensuring we don't have discarded needles out in the public realm and instead move those in. And so in Toronto, the political issue here was how quickly can we get these opened? Because supervised injection is a solution to the problem, not a problem itself.
So you have not had local businesses or local homeowners up in arms about this?
Well, we've had some opponents. Listen, I try to put in a speed bump and I have people who are opposed to it. There's never consensus on anything. But we held public meetings and we had people coming out en masse in support. And that's where I say we've seen a change because in these communities, people say supervised injection is part of the solution to public safety and public health, as opposed to something that's going to cause a problem.
Your report, if I understand it, did say that if you're going to set these things up, you need very clear rules about supervision, etc., that everybody needs to understand. Can you just, for example, what are the rules that people are going to need to understand and follow?
So some of the rules, so there have been more than 90 such facilities throughout the world. And each one has its own set of rules. And what we argued was that we need rules that are appropriate for the local context. But some of the rules, for example, relate to minors. So if somebody is under age 16 and they want to inject in supervised injection, is that allowed or not? If somebody wants to assistance in injecting, is that allowed or not?
What are the answers to those questions?
Well, the answer to those questions are going to have to come in the reports that the sites have submitted and through discussion. I'm not here to give those answers. I'm here to actually to say that these are the questions that the facilities themselves have to establish the answers for.
Do the facilities themselves supply the drugs?
No, these are under current rules. People bring their own drugs that they have acquired in whatever way they usually acquire the drugs, and they inject those within facilities.
How do we know, Joe, that the drugs that they will use on those sites, which presumably they will bring themselves, are safe?
Well, we don't. And so what's happening right now is people are using increasingly, so say you're using heroin, it might be cut or laced with fentanyl, which is an extremely fatal and potent substance. And so rather than risking a fatal overdose in an alleyway, when you have it consumed in sight under a nurse's supervision, if this drug is laced or if you take a stronger dosage than you intended, you have a nurse there to help bring you back to life. But I think the principle here, which is key, is that with supervised injection, it's not the solution to the overdose crisis. What it does is it enables you to reduce the harms associated with drug use, but the solution is comprehensive. It's treatment and prevention. So the model in Toronto is you come into a site where you can use drugs you've pre-obtained, but then we also have treatment on site. And so if and when you're ready, not only do we ensure you don't die if you're using, but we can help transition you to treatment. I like to use the analogy that if I had a sibling who used drugs, I'd want them to stop. But I'd also want to keep them alive long enough that they had a chance of stopping. That's what these sites will do.
Can I ask a totally horrible question here? But I know people watching,
Yeah.
some people watching are going to be asking this, and I therefore do not want to ignore this, as unpleasant as this question will be. Who cares if they die?
Well, here's the thing, is we all care. It's a moral question to care for each other.
We don't all care, Joe. Not everybody cares.
Well,
So we can't say that. There are going to be some people who say, these are drug abusers, these are people whose lives are out of control. Why spend my tax dollars to help save their lives when they're determined to kill themselves?
well, to which I would say it's a public health issue. Just as if somebody has cancer, we all have a responsibility to ensure they have treatment. Just as if somebody has a mental health issue, we all have a responsibility. If you're using drugs, we all have a responsibility. People who use drugs are not just hidden in the shadows in the alleyways. They are found in every community. They work on main streets, but they also work on Bay Street in Toronto. We are all affected, and we're all worse off when we don't care for each other.
Ahmed.
Yeah, just to add to that, there are studies that show that the most stigmatized condition in healthcare is addiction. More stigmatizing than HIV. There is tremendous discrimination against people who use drugs. And part of the response, the comprehensive response that Joe was talking about, is dealing with that stigma and discrimination. So I'm glad you asked that question, because it's a real problem. And we need to have a public discussion about drug use. It's not just about supervised injection, it's about drug use and addiction in general. As Joe said, there are prominent politicians who use drugs, there are prominent celebrities who use drugs, but everybody has people in their family who's been touched by addiction. Addiction is so prevalent that we need to actually confront this and discuss it in a really open, honest way that we haven't done yet. So I'm hoping that this will be part of that response.
So we should not look at we should look with a more sympathetic eye to the plight that these people are in, is your view?
We should recognize that everybody is touched by addiction, that this is not a moral failing, that this is a health issue, and that people need help, and that we can actually offer help to people to deal with their addiction.
And I would just, in 2004, we had 146 people in Toronto die due to overdose. It was a crisis then, but we didn't treat it as such. Now, that number has increased to 258 people. And it's seen as a bigger crisis, but it's always been there. The difference is in the past, too many of the people dying due to overdose were dying in hidden spaces, in alleyways, they were dying alone. And what's changed now is that with the arrival of fentanyl, the people at risk of an overdose, it's moved from more the habitual drug users to occasional and recreational users. So suddenly, you might be doing a line of Coke, and guess what? It's laced with fentanyl, and that's it, game's over. And if it takes a crisis of this proportion, if it takes the arrival of a risk of a fatal overdose into a broader swath of Torontonians, if that's what it takes to make us all wake up and treat this issue like a public issue, then so be it. But we all have a responsibility.
Let me follow up with this, because you've made the case. There are going to be people out there, though, who will say, this just rubs me the wrong way. This just feels like the official seal of approval of City Hall is going on people abusing drugs. What's the argument against that?
Well, it starts with the following. One of the reasons we now talk about supervised injection sites and not safe injection sites is that drug use is never safe, right? But it's going on, and it will continue to go on. People use drugs for all sorts of reasons, and we have a responsibility to respond to it with a public health approach that's based on evidence about what works. If we want people to stay alive longer, harm reduction works. If we want to help people move into treatment to get off drugs, harm reduction is a necessary component of that. This is about evidence-based health policy that works, as opposed to ideological-based drug policy that criminalizes it.
Speaking of evidence, let's put some on the table here. We love charts here. So if you would, look at the monitors here in the studio, and we want to look at the cost per infection averted. Because I think, Ahmed, you looked at this in your report, and here we are to avert HIV in Ottawa versus Toronto. You see the Toronto number is so much bigger. And then again, to avert Hep C, the cost in Ottawa, and again, comparing that to the cost in Toronto, and once again, 3 times higher by the looks of things. How come?
So there's a lot that's going into those numbers, but there are 2 or 3 points that are really important to recognize there. The first is that the prevalence of HIV and hepatitis C among people who inject drugs is actually considerably higher in Ottawa than it is in Toronto. And the second point is that the concentration of people within neighborhoods is also higher. People who use drugs is also higher in Ottawa than in Toronto. So it's actually you get more efficient reduction in bloodborne infections like HIV and hepatitis C through supervised injection when you have a lot of people who are infected and they live in close to each other, like in Ottawa, rather than Toronto. But the more important point, I think, is that all of those issues, what the prevalence of HIV and hepatitis C and overdose are, where people live, what kinds of drugs they use, how close they live to each other, really mean that there isn't a single model of supervised injection that's going to be appropriate for every city or every community across the country. Rather, each community is going to have to look and decide for itself what model works best.
But as you consider it for Toronto versus other cities, does that make it a tougher sell, seeing that it's so much more expensive to avert these problems in Toronto than elsewhere?
So we're only looking at the costs there. We're not really looking at the benefits.
At the benefit.
And so we did some more analyses, some cost effectiveness analyses, and these are highly cost effective interventions. I mean, in terms of how much you get for the dollars you spend, they are comparable to anything that we do in healthcare.
Just help us understand that, because by spending this money up front, what higher costs, presumably down the road, are you avoiding?
Yeah, and this is where emergency room visits, hospitalization, and the added and increased healthcare costs of dealing with an overdose after it occurs, as opposed to preventing it or supervising it in real time. The cost savings, we're not doing this work because it's going to save us money. We're doing this work because it's going to save lives. But there are huge cost savings to being more proactive on a harm reduction basis with supervised injection, as opposed to straddling all our emergency rooms and hospital rooms with the after effects of an overdose. And I think, Doctor, you went through in detail in some of these numbers, looking at Toronto and Ottawa, if I'm not mistaken.
That's right. And, we have highly effective treatments now for both HIV and hepatitis C, but they're also really expensive. So if we can prevent even a few HIV and hepatitis C infections at a reasonable cost, there are real cost savings to be had down the line from that.
Gotcha.
Well, I think, and that specifically is supervised injection. Yes, it helps to prevent a fatal overdose, but it reduces the likelihood of transmission of hepatitis C and HIV. So the long-term cost savings of reducing the number of people living with HIV are immense.
I know we talked about neighborhood concerns earlier, but I want to return to it for just a moment here. You do know Joe Mammoliti, don't you?
I do. Very well.
I remember,
colorful character, I believe.
remember him when he was George Mammoliti, and he was a New Democrat member of the legislature 25 years ago. Your fellow city councillor had the following to say about this. In my opinion, there's no such thing as a safe injection site. I think that the word safe is misleading. If anything, you're creating chaos and unsafe neighborhoods in those safe injection sites, and you're localizing the illicit drug dealer. The dealer isn't going to be touched anymore because he's going to be selling outside the safe injection sites. Because what we're doing, in fact, is saying, it's all right. Give it to the addict, and they're going to come inside and take it safely. That, to me, doesn't work. Want to take them on?
Sure. I mean, listen, there's fact-based decision-making, which is what we're doing here in the City of Toronto, and then there's decision-based fact-making, which is what Giorgio Mammoliti specializes in. The simple answer is this. There are more than 90 supervised injection service sites around the world, including 2 in Canada right now in Vancouver. And in every case, the research and evidence has shown that not only does it improve public health, it also improves public safety. That, in fact, in Vancouver, it was shown that what happened with the introduction of Insight was a decrease in a lot of the petty crime often associated with drug use. So what we see here is a model that actually does the exact opposite based on fact than what Giorgio Mammoliti thinks. This is good public policy, and I think, with all due respect to my colleagues who didn't agree, City Council voted 36-3 in support of these sites. Now, you've been covering City Hall in Toronto for a while. We never vote 36-3 on anything. We debate every issue, whether it's a tree removal or a speed bump. But we came together as a city with John Tory, our mayor, and the chief of police supporting these sites because they work, and that's what we're going to make sure.
One other point I would add, Councillor Mammoliti was talking about people selling drugs. The exemption from the federal act is really for possession of drugs. It says nothing about selling drugs. Selling drugs remains illegal. It remains under the auspices of the police to control who sells drugs. Supervised injection is about using drugs in a supervised environment to keep people healthy.
I do understand that, though, but does it not make common sense that if you do want to sell this stuff, the best place to sell it will be right close to those clinics?
Well, one of the things on that is all the research has shown with supervised injection is that people do not travel to use drugs. They use drugs in the neighborhoods where they are already, which is why we set up in Toronto these 3 sites in the neighborhoods where drug use already takes place, where drug dealers are already dealing. And the partnership model of drug policy says, yes, you need harm reduction, you need treatment, you need prevention, and you also need enforcement. And the model we've created in Toronto, just like in Vancouver, is one where we work collaboratively with police to develop a protocol and a model for that area. And so that's one of the key pillars here, is that when it comes to drug use, just because you're talking about public health doesn't mean you're not talking about enforcement. But you ensure that the enforcement strategy, the policing model, is going to help keep people alive while also focusing on some of the dealers.
I presume you work with the police in setting up this new policy?
That's correct.
Are they on side?
Yeah, Chief Saunders here in Toronto is supportive of these sites. And, I have to say, I spent a lot of time with the chief in the lead up to City Council's vote. We spoke at length. And, it's not always easy when you're talking about a change in policy. But our police here in Toronto understand that good public health policy works alongside good enforcement when you do it collaboratively.
Couple of minutes to go here. Let's cover a couple of more things. How long before these sites are up and rolling?
Well, I'll tell you, they should have been up and rolling yesterday, and we need them today. Now that the province has said that they will be funding them, we're beginning construction. In Toronto, we're doing the necessary work. As soon as the sites are up and constructed, the federal government has said they will give us the necessary exemption that we need to legally operate them. So we're looking at a matter of months. If we could do it in days, we would. Unfortunately, construction takes a little bit longer.
And Ahmed, the question for you is, we've done numerous stories on this program outside the city of Toronto. In fact, in lots of places in rural Ontario where this is an issue. Do we need these safe injection sites in rural Ontario as well?
So drug use in rural communities is a real problem, and we need something in rural communities. As I was saying earlier, we need models that are specific to each community, that work in each community, that take into account how to structure harm reduction services. But it is an issue in rural communities because getting people to travel to a supervised injection facility is not easy. So we need to think about different models. Where can we do supervised injection in settings that are accessible to people? Maybe in pharmacies, maybe in hospitals. We need to be broad in our thinking, but that's a research agenda.
I don't mean to make you sound younger than you are or me older than I am, but when you say I've watched things at City Hall for a while, I covered your mother when she was on Toronto City Council, so you're right about that, and that was a little while ago.
It was, and arguably, well, I think for sure she was a better councillor than I'll ever be, so that we'll probably agree on too.
That's Joe Cressy, Ward 20, Trinity Spadina, Toronto City Councillor. Ahmed Bayoumi, Professor, Department of Medicine, U of T. Thanks to you both.
Thanks,
Thank you.
Steve.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.